Number one, antecedent-based interventions. These are events or conditions set up before an activity or a request is made by the child or the individual, and these are designed to encourage desired behavior, at the same time, reduce disruptive behavior. The number two, augmentative and alternative communication, or AAC. Many of you who work with children with autism may have already been using AAC devices, and that is number two in the list of EBPs. These are alternative ways to communicate beyond speech. Children with autism may have speech. Many of them may choose not to use speech to communicate their needs and wants. So there are alternative ways to communicate for such children. This could be using pictures or using assistive technology devices or using sign language. Number three, higher sensory integration. It used to be called sensory integration therapy. It helps process sensory information. These are visual, auditory, or tactile inputs. And this sensory integration treatment or approach supports adaptive behavior. Number four, behavioral momentum intervention. It begins with easy requests, and then gradually you add more difficult tasks. So it helps the individual persist with the task. Number five, cognitive behavioral or instructional strategies. These focus on the individual's thoughts that influence behavior. So you work on helping the individual reframe or change their thoughts that might result in negative behavior. So it combines cognitive strategies and behavioral strategies, both thinking and behaving. Number six, differential reinforcement. It reinforces desired behaviors, reduces disruptive or inappropriate or maladaptive behaviors. Importantly, this is non-aversive. No harsh punitive techniques are used when you use DR. Number seven, direct instruction. You would think this is common sense, but it has a lot of research evidence to show that it's very effective. So what do you do here? You provide structured and systematic instruction. You use scripted lessons. There's no ambiguity, so everything is direct and clear. It promotes mastery and generalization. As we know, many of our students with disabilities may have difficulty generalizing tasks learned in one situation to other situations. So direct instruction helps with mastery and generalization. In the next presentation, we will look at the next 7 set of EBPs.